Okay. Well, thank you everybody for attending. My name is Chuck Ulrich. I'm president of NRASP, and I'd like to welcome you all to this virtual meeting. You will be receiving a gift card to a local restaurant in lieu of us getting together for a face-to-face luncheon and meeting. So watch your mail for that. And if you don't receive that for some reason, just reach out to myself or Becky and we'll get you taken care of. So, all right, community outreach. We have a couple of needs there. One is we are looking for a new chairperson for that committee. So if anybody is interested in helping out with that, that encompasses the community outreach program that we've done in the past, the in-person speakers, as well as helping with the scholarships that we offer. Andy St. John has been heading that committee up and he is stepping down. So if anybody is interested in helping out with that, reach out to any of the board members or reach out to me and we'll get you connected with Andy to get up to speed to where things were at. So another thing with the community outreach is we are again offering scholarships. So we're offering 3 $1,000 scholarships this year. The deadline right now is September 30th to apply, but that may change given these unique times we're in right now. So the scholarships are not only for college-bound students, but they can also be used by you, our members, to further your safety education. So check out the NRASP website under the scholarship continuing education tab for more information, and the application is there as well. The golf outing is scheduled for September 22nd at the Village Green. It's going to be an 18-hole tournament with a noon shotgun start. So if you haven't registered to participate in that, go ahead and do so, and we'd be happy to see you there that day. The conference, we are offering the conference virtually this year so that we remain within the CDC and Department of Health guidelines. The event will be split into 2 days, so you can save the dates as follows: December 1st and December 8th. So there'll be a schedule and more information regarding the specific sessions and breakouts and all that coming soon. So with communications, check your Facebook, or check us out on Facebook, LinkedIn, and YouTube, and share us with your network. We put a lot of good information out there, and we'd love to have that shared with as many people as possible and get the word out about NRASP to not only our colleagues and friends in the safety field, but outside of that realm as well. There are quick links on the NRASP website in the top left corner under the logo that you can click on to get to each of those pages. As always, if you have any questions or concerns, please feel free to reach out to an NRASP board member. And our phone numbers and emails are all listed on the NRASP website as well. So with that, we'll turn it over to Beth and we'll get started with our meeting. So thank you and enjoy.
Okay. So can you see me okay?
Yep.
Just want to make sure. Okay. So my name is Beth Brantner. I'm a counselor at Prairie St. John's, which is a behavioral health hospital here in Fargo, North Dakota. I'm both an addiction counselor and a mental health counselor, and I have those licenses on both sides of the river. So we're going to be talking about stress in these COVID times. As I was researching things have changed quite a bit, and so this is a really fluid kind of thing, but as of today, as best I've got, the information that I'm presenting you is pretty current. If you have any questions, please let us know at the time. So I'm basically a counselor, and I'm used to having more interactive kind of things. And so we'll go from there. So yeah, stress in 2020, COVID-19, here we are. So stress, and this is from the National Institute of Mental Health called NIM. They define stress as how the brain and body respond to any demand or any type of challenge, such as performance at work, school, a significant change, traumatic event. All of those things can be stressful. And what happens is with stress, it's very individualized, but where our body starts reacting like we are being threatened, and our body starts putting out these hormones such as cortisol and epinephrine or adrenaline, which then makes our heart rate go up. It makes our digestive system change, kind of shut down. Our breathing goes up, and we start reacting as if we are being threatened. And with stress, particularly what we've been experiencing now, it's chronic. And so when our body has experienced that over a long period of time, it can be damaging. So again, I was saying that this is individualized on what stresses you out. Before we had COVID, before we had all of the racial kind of things, before you had all those things, what I would hear when I talk to my patients or clients, we talk about family stressful, career stressful, having a job is stressful, not having a job is stressful, relationships. But we didn't hear so much about health or the state of the country or some of those kind of things. That's what's becoming more stressful now. As I was doing some research for this presentation, I found out that the American Psychological Association, or known as APA, they've been doing a yearly survey on stress in our country, and they started in 2007. Just kind of measuring what's going on with us in stress. And the experts in stress are talking about how it actually is it's affecting us as a species. It's the long-term stress is of a concern. But anyhow, given with COVID and that kind of thing, they decided to do 3 monthly stress surveys. So they did one April, May, May, June, and June, July. Okay, and they surveyed over 3,000 people. You had to be living in the States. You had to be 18 or older. The first wave that they did, and that's the chart I have on screen right now, they kind of really focused on what's happening, especially the parents. They found out that people that are parents, particularly with school-age children, experience more stress than people who maybe their children are grown, adults, or people without children. But they kind of really focused on family. And what they found out that 74% of the population are significantly stressed out on concerns whether a family member is getting COVID or not, right? So those of us who have family members who maybe have pre-existing conditions, health conditions, perhaps they are elderly, we're quite concerned and are still concerned. I'm not saying that's necessarily disappeared. Again, 74%, so same amount. We're quite concerned about the government's response to COVID. And again, the same amount, really concerned about their routines and how they're adjusting to new routines. So for example, normally, so I'm just backing up a little bit. So normally I do things that are face-to-face and we have much more interaction. So I'm going to be sharing more from my own personal experience, which is a bit different for me, but I just want to make this a little more personal, okay? So for example, adjusting to new routines. So I have a sister who works at a local college. And in March, as we all can remember, they changed things quite a bit and she started working from home. And at first it seemed like, okay, kind of nice. You can go to work and you can be wearing sweats outside of, from shoulder up, you needed to look nice. But she shared how actually being at a computer 8 hours a day was far different than working in the office. So for example, if you have a meeting, you're face to face, you get to go up, you meet people, there's more movement, there's more interaction. and as opposed to sitting in front of the computer every day or 8 hours a day. For her, they needed to find a different chair, to find a different desk, because she was finding she was really being in pain from sitting that long. So there were a lot of adjustments with that. I have one daughter who has children who are in school. She has a job that was one of the first that was closed down. And so then, so her job is closed down. She doesn't have that money coming in. And then her children, school is now from the computer, right? And when you have one computer and you have 3 kids who are in school, that's sort of a juggling act. And that was stressful on all of them. So a lot of disruptions in routines, doing new routines. How do I do this? No longer going to a gym. How do you get exercise? All of those kinds of things were really stressful. People concerned about, yes.
I apologize. I don't mean to interrupt, but I don't think your slides are changing, hun.
Oh, I'm still on just the personally stressed survey.
Okay, because we're not seeing the survey.
Oh, well, let me see.
You might want to just double check your screen.
Okay, well, I'm glad you said something. So you're back on this very first screen?
Yes, ma'am.
And you're not, okay, so now you're not seeing.
We don't see anything on your screen.
Okay, let me see, PowerPoint show. I'm glad you interrupted me. I did not understand that. Save this one. Is that making a difference? Are you seeing a man with COVID on his back, kind of like a cartoon?
Yes, that's what I have on my screen.
Okay. Now do you see stress and definition?
No.
Okay.
Beth, can you forward your PowerPoint to me real quick, and then I'll put it up on my screen?
Let's see. You know, you're asking me like the impossible, right? I'm trying to get out of this. What I have is your screen sharing is paused, and I'm trying to unpause it to resume share.
There you go.
Okay.
You're working now.
Yes. Okay. Thank you, people, for adjusting and patience. Okay. So this slide, I was talking about, we reviewed it. You heard me auditorily, but you didn't see it. Many apologies. It's just the definition of stress, or one of the many definitions of stress. This one, we talked a little bit about what stresses you out. Stress is very individualized. Some people, I have to tell you, I find that some people are very stressed over finances and bills, and then I run into people who are not stressed about that at all. Some people are very stressed over relationships, some are not. So it's very individualized, and it's individualized on how we react to that. But on this slide, I was just trying to show you the everyday ones, the things that I was talking about with my clients and patients before COVID even hit. So, but things have changed. This one is just giving you information about how the American Psychological Association has been doing this study or the survey on stress on a yearly basis. And, but with COVID, they made a change, and they did 3 months, a survey every month for 3 months, which is some of the information I want to show you. But what they're saying, and this one I thought was important, is that this pandemic has altered every aspect of American life, from health and work to education and exercise. They're warning that the negative mental health effects of the coronavirus will be serious and long-lasting, but we're not really sure how it's going to affect us. And so, I mean, we're in new territory. And some of the information I provide for you, I hope it helps. This is kind of where I was talking when you interrupted, Becky, so I'm so glad you did that. And it's just a slide from that first survey that did April into May. And it was really kind of focusing on family kind of things, but it shows you how high, people are saying they're significantly stressed out over these things. And so even the last one, missing out on major milestones, 63% of the survey of people are saying they're really stressed over this. So examples, right? We had COVID, and if you're thinking back at the end of the school year, things like prom did not happen. Things like the big graduation from college, graduation from high school, those things didn't happen. Access to healthcare services, so 66% of that. So for example, in my field, some of the things that we did is we started seeing people virtually. And I found that people I was working with face-to-face prior to this, that changed to being whether virtually on the computer or on the phone, that went fairly smoothly. But meeting new people virtually and getting to build relationships, that was a little more difficult. Self-isolation, okay? So they talked about social distancing. Lots of people were very concerned about it and were doing that. But if in the mental health world, for example, when we talk about managing stress and anxiety and depression, we talk much or greatly about interacting with other human beings. And so for the elderly, for people who struggle with mental health, all those kinds of things, people that struggle with addiction, okay? Support meetings shut down and they're virtual. And we saw quite a few people where they relapsed, especially in the addiction world. That self-isolation was bad. I also saw a lot of people where their depression got way worse just from that self-isolation. I think we all know that with people losing their jobs, people having furloughs, finances really changed, and there were people that it took a long time for them to be getting money coming in. I shared with you that I was going to use some more personal examples. So I have a daughter that she works, her job is, she's self-employed and she's like in the beauty industry, aesthetics. She was one of the first people where that had to close. And because she's self-employed, the applying for unemployment, those kind of things were more complicated and took her, there was quite a delay before she started getting finances in. And so she's a single mom with 3 kids. That was stressful, and she needed to ask and get help from family to help them get through that. Okay. This one I thought you folks would be particularly interested. So again, that May survey, they were looking at the economy and they compared it to August of 2019. That was closest comparison. But back in 2019, 46% of people were concerned about the economy. It went up considerably in May of 2020. Work. A year ago, 64% people were concerned about work. That went way up to 70%. Again, we had people buried, and I don't know in your businesses exactly how it affected, but I know, for example, my one kid, getting haircuts, getting her eyelashes done, all those kind of things came to a screeching halt. So she was out of work. Some workplaces, people had to take mandatory days off. Some people had to take furloughs. And so there was a lot happening. Also, think about, for example, I work in a organization where we deliver healthcare. We need to provide for our patients, but sometimes people they might need to take time off to take care of family members, or they needed to take time off to be with their children who are now no longer in school. So then that means people here at work have to pick up or absorb their responsibilities. And so things changed a lot with work. Let's see. The second wave kind of focused a little bit, so this is that second survey they did, and this focused a little bit more on kind of what's going on in the nation. But they had a question looking at how people felt about where we're at as a country. And 72% of the people responded that this is the lowest point in the nation's history that they could remember. And so if you think about people over 18, you're capturing people that lived through 9/11, you're capturing people who lived through Vietnam, you're capturing people who lived through World War II. I mean, there's a lot, and 72% reported this is the lowest point in our nation's history. As compared to, you can see 2018, oh, I didn't do that very well, 18, 19, and 17. I didn't do that chronologically, but so it's gone up considerably. So all I wanted, my point of this is to understand that there's additional stress on your employees and your coworkers than there was like a year ago. This is just that this is kind of a response on the government. So it's a little bit different, but again, it's kind of looking at the overall. 67% said their government response is a significant source of stress in their lives. This one, the third survey, they kind of spent time comparing, and I thought this would be interesting to you folks, is that they were looking at the source of, like how's our stress on our adults worried about getting corona. Okay, so this is looking at the April, May, June, July. And if you look at the Midwest, so we were still going up back in July about concerns about people getting corona. I don't know if they did a survey right now. I don't know how that would shake out. And as best I know, they haven't done any further surveys since the three that I just showed you. I would like to show you, it's called a stress vulnerability model. And it's, we all learn differently, okay? So some of us learn auditorily by hearing, some of us learn visually, some of us learn kind of hands-on. So I wanted to show you this both visually and auditorily because it's not too complicated and it makes a lot of sense to me. It's really a mental health kind of, it was two psychologists that put this together. It's been around for a while. But as you can see, there's a lot of stress that we are all experiencing, and I'm not even addressing stress in children, but our children's stress is affecting us as adults too. But there's a lot of stress going on right now, okay? And we could go and list all kinds of them. I'm not doing that right now in interacting with you folks, but I showed you that one slide, but finances, relationships, work, not having work, bills, school, future, all those kinds of things, very stressful. The weather can be stressful, particularly in January in this part of the country, right? But anyhow, what this model is saying, that we all have what are called biological vulnerabilities. And what those are is they are things that are part of our genetic code. I'm going to use me as an example, right? So, and I have a great family. I'm not putting them down. But in my family, we have some things that are, tends to run the family, right? So we have things like anxiety and depression. And we have a whole lot of things like arthritis and fibromyalgia, where your body kind of turns on itself, okay? We also have things like alcoholism. And I have a good family, and 2/3, just so you know, 2/3 of the families in our country have been touched by by addiction. Anyhow, so those are all part of my genetic code or my biological vulnerabilities. I also have things that I've accumulated along the way. Using me as an example, which I don't tend to do we're doing it this way. So when I was 22, I was in a car accident where I was rear-ended by a semi who was coming off a highway and his brakes failed. So I ended up with some permanent damage. Part of it's head injury, part of it is pain, okay? So that's also part of my biological vulnerabilities. So what this model is telling us is that if I'm not managing my stress, it is going to affect those biological vulnerabilities. And what's going to happen is my symptoms are going to increase, okay? So for example, if I'm not managing stress well, my pain is going to increase, all right? And things can increase to the point where people need to have medical interventions. So I'm sure some of you have asthma or you know people with asthma, for example. So people with asthma, they're not managing things well. They got a lot of stress going on, okay? And what can happen is they can start wheezing and things, and it can get so bad that they need to be intubated, okay? Now we're talking ER hospitalization. Or I have somebody in my family who's type 1 diabetic. If he's not managing his stress well, his blood sugars go wonky, okay? Which makes sense because what happens with our stress, remember I was telling you about the stress hormone like cortisol and stuff, part of that process, okay, when our body's experiencing a lot of that, is our body will call upon our liver in particular. It releases glucose, which is like sugar, okay, into our bloodstream so that we have energy to fight or flight or battle what's stressing us out. But when we have chronic stress, so now our blood sugars are going wonky, right? Stress can be so integral to how our body functions. Okay, so for example, I've met people, I heard about this in school, which was a long time ago, but I hadn't met anybody until just the past few years. So I met people, these were high functioning adults, and they had families and jobs and careers, right? High functioning adults. And things came along in their lives, like for the past year, okay? A lot of things happened. And what ended up happening to them is they became psychotic, all right? So they had never had anything like that happen to them before. It's kind of out of the blue, but it was stress-induced psychosis. Psychosis is where people, they might have hallucinations where they see or hear things that other people don't, or they had delusions, which is a belief system, very sincere, very belief system on something that's totally incorrect. And so I'm just trying to give you an example of how stress can really affect us, okay? When a part of my job is I'm in the hospital half the day, and I talk to people about what was happening in their lives before they came into the hospital. And most of them had a lot of stress going on in their lives. And symptoms got so bad, they ended up being in the hospital. So typically what happens is they become suicidal, their usage it kind of explodes, or a combination of that, okay? So then what happens in this model is, and this is what I see, is a lot of times people, in an effort to start managing that. So for example, we get stressed out, our muscles start getting tight, we start getting headaches, our shoulders go up, we get stomach aches, things like that. So people often turn to alcohol, and sometimes when I say drugs, I mean like street drugs, right? But North Dakota, and I'm for sure some of you know this, North Dakota's had the dubious distinction of being drunkest state in the country. Fargo, drunkest drunkest city in the country. North Dakota, highest binge ratings in the whole country. There's a lot of alcohol use in our communities, and it's kind of normalized. good, bad, or different. But people, if they start turning to alcohol or drugs to manage their stress, it works, and it works temporarily, okay? But it's not a long-term solution. And for a lot of folks, what happens is they start adding to their stress. So for example, let's say somebody starts they self-medicating by drinking, all right? Drinking, maybe it now turns into more of a daily kind of thing because we've had a whole boatload of stress hitting us in this year. So now they are having more difficulties with relationships. They aren't functioning at work as well. They got legal things, DUI or something like that. They're spending a lot of money. So now their stress is increasing, symptoms are increasing, so now they're drinking more. It just gets bigger and bigger. So this, although it works temporarily, and that's what a lot of people are looking for, and it makes sense to them, but in the long run, it makes things worse. So that's not a solution. Medication. So if you have a chronic medical illness, it could be anxiety, it could be high blood pressure, it could be diabetes, it could be heart disease, COPD, whatever, okay? It's really important that you are in contact with your personal care provider, okay? If you are on medications, you take them as prescribed. If you are having side effects, if they're not working, you are in communication with that person, okay, or with those people. It also means, so if you're diabetic, right, it means you're counting your carbs, you're taking your blood sugars, you're doing all those kind of things. But those will help manage those biological vulnerabilities so the symptoms don't increase a great deal, okay? And so far, Becky, I'm getting that nobody's having any questions. Is that correct? Are you not hearing me? Oh.
Sorry, I am myself muted.
Oh, okay. I'm
Beth,
sorry.
so
I'm like, did I lose everybody? Oh, no. We got it, but no question.
I do have one question for you though. You had made a comment that the transitioning to virtual care has been a bit of a struggle. How are healthcare providers helping patients transition to virtual care?
Right. So I can only talk about this aspect. I'm not I don't really have experience so much in the medical, okay, but in the psycho, and so this part, for example, in our addiction treatment, we have a lot of levels there. And in the outpatient program, which is where people go 3 hours an evening, 3 evenings a week, right? And so they started doing virtual treatment, and I've helped out with that. And it's been an adjustment. And one of the things that, we had it is where people, at first it was an adjustment, because people weren't meeting people face to face. But as they did it, they, they could set their screen so they could see everybody's face. That was part of it. And it wasn't as big of a crowd as here. It was more like 10 people. So it would fit on the screen. And we encourage people, like discussions. So there was a lot more interaction. It was virtually, but much more interaction, right? We still also had people come in individually, like once every 2 weeks, so they could meet with their therapist individually to help build that. But it's an adjustment. And, for some folks, think about it this way. For some folks, sometimes talking about things that are difficult, the little bit of distance that you have virtually can be easier. For some folks, it's not. So it's really individualized. Does that kind of answer your question?
Yes, thank you.
Sure. Okay, so now going back to the stress vulnerability model. Okay, now I want to talk. So what do we do about the whole stress thing? And this part, I hope that really kind of sinks in, makes some sense to you folks. So the first thing is there's all kinds of skills that we can have to manage stress, okay? And skills such as meditation. There are many, many ways to do a meditation. A lot of us think it's like clearing your brain and doing Om. That's just one. There's another one called mindfulness, and mindfulness has been around for eons. It's newer to this part of the world, to us. Mindfulness is really just helping yourself, focusing on the present, okay? So what we tend to do is like I know some of you are doing this. You're thinking about, what are we having for supper tonight? I need to go to the grocery store, and I got to get this report done, and I got to do that. I got to do this email, respond to that, right? We tend to multitask a lot. And what happens is it takes away from our present moment, okay? Here's an example. They did a study, I think it was in Florida, but don't quote me. What they did is they had two groups of people, okay? And it was on an individual basis, but each person in each group, their task was to wash a bunch of dishes, okay? But in one group, what they did is they taught them mindfulness. And what they did is they asked them to, while they were washing the dishes, what were they smelling? What were they feeling? Okay, with the soapy water and the heat. What were they tasting? Not to taste the bubbles, right? But using your five senses, what are you hearing? And just really helping them focus on what they're doing, right? What they found, everybody got the dishes done. They got them done about the same time frame. But the people that did the dishes, where they were just really in the moment, it was a much more enjoyable experience, okay? And so mindfulness, there's a lot of different ways to do mindfulness. There's all kinds of things online that you can do with it, but mindfulness is a really good way. It's a good skill. And if you just do it even for a few minutes a day, it can help manage stress. Other things for skills, we can exercise, right? We can talk to people. Even though we're doing some distancing, we still have things like Zoom and phones and all kinds of things where we can stay in contact with people, okay? One of the skills, and I just have a slide, next slide I want to show you, is really looking at our thinking, okay? And this one is particularly focused on COVID, okay? And what happens is with folks is we tend to experience anxiety, which is where we worry and get nervous and things. And anxiety is the most common mental health issue. About 19% of the population pre-COVID experienced it. I suspect it's gone up significantly, but I don't have any data to justify that, except my own experience. But we tend to focus on what's going out that's external to us, right? So right now, I can pull up, use my phone, and I can look on stuff on what's going on with COVID 24 hours a day, right? 24/7. I can watch news 24/7, right? I can look at people's opinion, listen to people's opinions on what's going to happen. I can do nothing about those things, right? And so when we start putting our energy and time into things we cannot control, our stress goes up considerably, right? But if I start looking and focusing on what can I control, so that would be the inner circle, right? My attitude, I can do a whole lot about my attitude. The experts say that we are the only species that can think about our thinking, okay? Now, I don't know about dolphins or chimps, but I do know I can think about my thinking. And if I can think about my thinking, I can change it. So if I have a bad attitude, okay, it takes some effort, I can make some changes. Okay, I can start looking at the more positive side of things. I'm going to give you an example, and I'm going to challenge some of you just to really give this some thought, see if you want to do this. What it is it'll take you a minute a day. You start making a list, and each day you write down one thing you're grateful for, but no repeats, okay? So you start writing down, it'll only take you 60 seconds or so. It's called a gratitude list. And what we found, and they've done studies on this, it can really change things for us. It can change our brain so we're more positive, okay? It can change our attitude. I can change, I can control. Am I going to wear a mask? Am I going to social distance? Am I going to really be on top of washing my hands? I can limit, I can decide how much am I going to watch the news. Social, some of the social media stuff, Facebook, I'm just pick and choose what I look at, and it's not very often because I find that stressful. Okay. I can focus on what I can do instead of focusing what I cannot control. It's a huge game changer for a lot of folks. I use this for a lot in a lot of therapy, but it changes our thinking. Okay. The other thing we can do to manage our stress is support, right? Having positive people in our lives. And I'm sure we all know Debbie Downers. That stuff is contagious. So I suggest to people that they choose carefully and wisely who they spend time with, okay? Supportive people are important. With COVID and the social distancing, so the face-to-face support has changed. But again, we are lucky, fortunate enough that we have all kinds of technology. We can still maintain contact with people in our lives, okay? But choose wisely. So for example, people with addiction and who are maybe doing AA meetings, NA meetings, SMART meetings, there's all like 200, there's all kinds of different meetings. A lot of those meetings shut down, but there's a lot of meetings people can attend virtually. So it's different and it's an adjustment, but that's partly what we have to do. But support is important. Lastly, is called meaningful activities. Can really affect how we managing our stress, right? Meaningful activities are those things that give us joy. Those things that trip our switch, right? And I ask this a lot with folks, like, what do you do that gives you meaning? What's really important to you? And I run into a lot of folks where they can't really think of anything, or because they haven't done anything. What just gives you joy? I don't know about you folks, what you do, and I'm sure you're thinking about yourselves. Oftentimes I hear things that have to do with nature or outside. The question is, when's the last time you did that? So part of your job, as I understand for a lot of you folks, is you have people that you're dealing with, like coworkers, staff, that kind of thing. But part of your job also is it's really important that you take care of yourselves too. And so it's important that you take breaks. It's important that you eat well, that you get exercise, that you do things that give you joy. And sometimes that gets lost into the whole mix of things. Any questions so far?
I don't have any in the chat.
Okay.
Thanks, Beth.
I am going to, at the end, I'll provide some resources that will, they give you more resources. I mean, there's all kinds of things. You can have apps on your phone. There's all kinds of things that will address some of these skills and things like that. So we covered them very briefly, excuse me, but I'll give you more that you can research yourself. Okay, signs of stress, right? And might be things that you see in yourselves, might see in your loved ones, might see in your staff or your coworkers. But headaches and muscle tension, right? A lot of us carry our stress up here and we don't even realize things are going up, and this gets really hard. I'm guessing if some of you do this, you're gonna go, oh, that's pretty hard. And we get headaches, right? Chest pain, okay? When we're stressed out, we tend to breathe shallow. It's a shallow breathing and we get tight. Or it could be associated with heart disease or some of those kind of things. Fatigue. If you're stressed out, we're putting out a lot of energy, maybe not in the right ways, and we're tired. Changes in sex drive, digestive issues. The sex drive can go either way. For a lot of people, when you're chronically stressed, the libido goes down. Digestive issues, nausea, constipation, diarrhea, people not sleeping, people waking up in the middle of the night because they're so stressed out and they can't fall asleep. So I imagine that you folks, as well as some of your coworkers, your staff, they're experiencing some of that. If you're not sleeping well, you're not performing well at work. Anxiety, that's where you feel nervous. You start going into that fight, flight, or freeze kind of things. People, their anxiety has been increasing with COVID, with all of those, with those things that those the APA, those surveys showed. Irritability, anger, right? And so people snapping at people snapping at their loved ones or their coworkers or perhaps their customers or their patients. That happens. Lack of motivation, just not having the oomph to do that, or lack, not focusing. That's going to affect jobs. This one is huge, feeling overwhelmed. And I hear that on a daily basis. And people, when we feel overwhelmed, we typically come to a screeching halt and we don't know how to go about things. How do we manage that? Kind of see more sadness, depression, overeating or undereating. People can't sitting still. Sometimes, and you may see this in some of your staff, where they just are really fidgety, that kind of thing. It might be different from what you're noticing. Drug and alcohol use. I will tell you from everything I've experienced in the past half year, it's increasing. Increased tobacco use, social withdrawal, yep, not exercise. People not taking care of themselves. So all of these things, all I'm trying to say is stress affects every part of our lives, and it can affect every part of our physical being. So what you might see at work, and I covered a little bit of this, but people making poor decisions, right? Or stuck not making decisions. That doesn't do companies well. If you have a decision to make and you get stuck, everything can kind of come to a screeching halt. People not being able to focus. Conflict, right? Conflict with others. That doesn't go for a smooth work environment. Lateness or absenteeism. I'm imagining people, you're seeing this. And maybe you're seeing people where it might, they might not say they're overworked, but I have too much to do. I can't eat lunch, I have too much to do, or I gotta stay late, I have too much. As I was preparing for this, and I was looking at some things, and I was looking at some stuff where people stay late. They're putting in more than 40 hours a week, which is typical, unfortunately. But in some respects, I think that a lot of us believe if we're putting in extra time, then we're getting a lot done, right? But some studies are showing that actually the people are not getting more things done. Isolation. So maybe some of your staff, they're not coming out, they're not participating, they're not at breaks, they're not getting involved. Something to watch. And my hunch is that you folks have more ideas than I came up with on what you might see with your coworkers or the people you work with that are indicating maybe they are stressed out. They've done some studies that I was looking at, and this is from Forbes. And what they were looking at right now is that long hours, the things that people are finding most stressful in the workplace, long hours, facing that family to work kind of adjustment or that work to family conflict. It's like we have two fronts typically. We got the work front and we got the home front. And if one is not going so well, but one is, most of us can handle that pretty well. But if both of them are really stressful situations, we human beings, we don't do well if that's going on and on. And that's what's happened with COVID, okay? Other stressful things that people say in the workplace is feeling like they don't have a lot of control over their job, or they have a lot of high job demands, or the job environment isn't going so well. So if the environment is more stressful, right? And you have people who are stressed, so they're more irritable and cranky and things like that, gonna have more stress in the workplace. Employees feeling like they don't have a lot of choices in their job, that they just their input isn't valued, okay? That one is very stressful. And then what they also talked about in this article that I thought was pretty interesting, put a quote around it, is that people resign. And there's usually 3 reasons they resign. One is there's a precipitating event. So something happens and they just like, I'm done. One is that their family and friends are going, you got to get out. This is too much. You're burning out. Or the other is they're physically or psychologically ill. They just can't keep going. And I used to be in management. Most of my career was in kind of in a managerial kind of place. And one of the things that I know, and we did kind of a study on it and where I worked, is we looked at how much does it cost to replace somebody, right? And we looked at, and it isn't just financial costs, although that's what tends to get people's attention, but how much does it cost to advertise? How much does it cost to it takes time to look at applications and resumes. It takes time for people to go through them and decide who they want to interview. It takes time out of people's day to do the interviews. It takes a lot of time to train people so they're competent in that job. And for the jobs I was looking at, we looked at it took about a year for those people to really feel comfortable in their jobs. They had a lot of details and things, a lot of responsibilities. Some of the things so you can kind of put financial numbers on those. What you can't put financial numbers on is, okay, so let's say someone is so stressed out, burned out, they quit. So then their responsibilities need to be covered by other people who are currently now stressed because of COVID and those kind of things. We have people who are worried, who maybe are not at their job because they need to take care of family members, or maybe they need to, forgot the word, they take the 14 days off because they were exposed, right? So then the people who are back at work, whether it's working from home or jobs, are picking up all the extra. So a lot of stress, it's a lot. And so what I found anyhow in my position is when we had quality people, and if we could do what we could, as best we could, kind of like being really creative, what we could do to keep people, we benefited from it and our residents benefited from it. So it was really important for us to, as management, to do what we could to keep people and keep the stress down. But I didn't do this during time of COVID, so it's a different deal. It's really important to protect employees from COVID-19. I suspect all of you folks are doing this. I do know personally of some organizations where they weren't doing this so much. It took them a long time to catch up, but they weren't providing like masks. They didn't have the hand cleaner, sanitizer all over. They weren't going in and disinfecting and cleaning things. And I personally know employees who that stressed them out. And then I know I know an organization where a number of people ended up becoming positive. Okay. It's important if people are ill to encourage them to stay home, which, before we had all this, so if somebody had, like say they had a cough or just a little bit of a cold, a lot of times people, you came to work even though you weren't 100%. It's changed. They talked about, and a lot of this was from OSHA stuff. They talked about how, we've had this, where if we were going to be ill, if we were ill for a certain number of days, different places I've worked, you needed a doctor's note. Well, in this time of COVID, clinics don't necessarily want somebody coming into a clinic that have those kind of symptoms, right? And so you might not be able to get in. They don't want you to come in. You might not be able to get a note in the time frame. So it's really changed things. people needing to stay home to take care of ill family members, and now they need to quarantine, or they might need to stay home to take care of their kids because they're not in school. This happened last spring, right? And the daycare is closed down. Discontinuing travel, I know that's happened quite a bit in places, really minimizing contact between employees. Again, I don't know what you folks are doing. And if we were face to face, you'd be telling me, but I'm sort of guessing. So I apologize if this is very redundant and you know all this. I don't know. Really educating staff. So for example, right now I have a niece who is a high school math teacher. And they've been spending a lot of time educating the teachers. How are we doing on time? We're about up. Teaching, so that they are up to date on what's going on. We just have a few minutes. I'm going to skip ahead. A lot of this you probably already know. This is the one I wanted to focus on. I don't know if you have, it's a magazine called HR Pulse, showing you a copy. This is the one that most recently came out, so fall. One of the things they talked about, which is really crucial for dedicated followership, that was a quote from it, is for the leaders to have compassion, trust, stability, and hope. Compassion for your employees, compassion for your coworkers, understanding, getting to know them, being trustworthy. Trust needs to be earned. We have some of that as issues going on in our country right now, but trust means what you say, you do what you say you're going to do. You're honest. Stability, showing them that you're managing this, showing them that, okay, we got this stuff, we can figure it out, and really helping to instill hope. So those 4 things, according to this magazine, or this article, are what really is needed for leadership right now in this long-term COVID thing. I am going to quit right now. We're really at the end. It's kind of like, you can see resources, you can see my bibliography. It's little, but just to see it, are there any questions?
Beth, I don't have any in the chat, but anyone can go ahead and unmute yourself at this time if you have any questions for Beth. One other thing that I'll make a comment on before I turn it over to Chuck. Beth's presentation has been posted on the NRASP website. So anyone who needs or is interested in accessing some of the resources that she shares, you should be able to do that now. And then tomorrow or later this week, we will also have this recording available on our YouTube channel.
Oh.
All right, I'll transfer over to Chuck now.
All right, thank you, Becky. And Beth, thank you so much. This was very useful information in these, I'd say, trying times. It's good to know this kind of stuff. So
we're breaking new ground, right?
Yep.
You're welcome.
Yeah, if anybody has questions, I assume they could reach out directly to you, Beth, if they wanted
Sure.
to.
Yep.
The other thing, membership, please watch for the survey that will be coming out after the fact. We use this information provided by you to provide the speakers that you, our membership, want and need to hear. So please take the time to answer that survey, and we'll take note of that in our board meetings. With that, I'd like to thank everybody for joining us today, and watch for the lunch certificate that will be coming in the mail. And everybody have a good afternoon and stay safe and healthy. Thank you.
Bye.